Our first speaker today is Dr. Dawn Simpson, who will be presenting on the living with fatigue after stroke. And this is an issue that's been raised a number of times in many of our previous conferences. Dawn is a lecturer in physiotherapy with the University of Newcastle. Before her PhD, Dawn worked in public health for over 20 years in the UK and Australia. Her clinical experience is predominantly in rehabilitation and aged care, and her clinical research interest is in stroke rehabilitation and recovery. She is interested in factors that influence sedentary lifestyle and sedentary behaviour, for stroke survivors in particular, and interventions that may improve post-stroke fatigue and health service models that could support improved rehabilitation and recovery outcomes. Unfortunately, as I said, Dawn is not able to join us today. However, has pre-recorded her presentation for our audience. We have allowed time at the end of her presentation to have a discussion with those online and with those of you in person here today to discuss your experience with fatigue and talk through some strategies that you may have employed in the past that have worked for you and assisted you to manage your fatigue. Please join with me to welcome Dr. Dawn Simpson.
Good morning, and thank you very much to the organisers for inviting me to present this morning. I'm very sorry I can't be there in person. I'd like to acknowledge that I'm recording this presentation on Awabakal lands this morning and pay my respects to elders past and present. So I'm speaking about post-stroke fatigue today. So let's start by thinking about what that is. So stroke survivors tell us it's something that persists long-term after they experience a stroke. It affects pretty much every single aspect of daily life, isn't always relieved by rest, and doesn't seem to necessarily be caused by exertion. It's an invisible symptom, and it can be highly unpredictable. And importantly, it affects at least 50% and possibly as high as 80% of stroke survivors. It's of varying frequency and severity, and importantly, someone's level of disability following stroke doesn't necessarily mean that they have severe fatigue. So somebody can experience relatively minor physical disability after stroke, but have very debilitating fatigue. We also know it's not related to the area of the brain in which the stroke occurred. And it's described as something that stops people dead in their tracks. And I've heard somebody describe it as a persistent acquaintance because it's certainly not a friend. So how can it affect stroke survivors? It affects people in terms of their thinking. So stroke survivors describe a brain fog that means they can't concentrate or focus, and the feeling of needing to just stop and give their brain some time out in a quiet space or a dark room or in a very reduced stimulation environment. Planning and organising, people talk about needing to actively plan and schedule their daily routines. Schedule in rest periods and really perhaps only have limited appointments per day or switch between different activities. And I've heard it described, people describe as needing to find your golden hour, so the time of day where you really do feel at your best to schedule in activities which are the most important to you. For some people, when fatigue hits, it can affect them physically. So they might find that they're catching their foot more when they're walking, or that their balance becomes more risky. Finding words might be a little bit more challenging, or people might experience the fact that they're tending to feel a little bit more clumsy with their hands and are dropping objects a little bit more. People also describe emotional fatigue, so feeling like they have less resilience to stress or emotional contexts and aspects. So fatigue can also leave people feeling much more cranky or more teary, or sometimes just flatter in mood. And I've heard it described as people feeling like you have a lot less of a filter. So there's no one single experience of post-stroke fatigue. Everybody's symptoms are different, and there's a wide range of ways that fatigue can present for people. And some people will have one or two of these symptoms. Other people might have all of the above. So what causes post-stroke fatigue? Unfortunately, we really don't know. One theory is that there's reduced kind of excitability or firing in the layer of your brain called the cortex. So it takes greater effort to get your brain cells firing in order to think clearly, move effectively, and control emotions. A second theory is that there's a lot of inflammation in the brain after a stroke injury. So after the stroke, your brain's sort of swimming in an inflammatory soup, and the inflammation increases the perception of fatigue. Your brain also works to kind of help and coordinate all the information that you take in from around you to effectively move and interact. And one theory of fatigue is that the function that allows us to kind of control and coordinate all of that work is disrupted. And in that disruption, the additional load perhaps causes the fatigue. And one final overarching theory that's been speculated about is that in relation to the initial injury, our brain becomes sensitized to fatigue over time. So even when the initial injury repair has been completed, a fatigue echo is left in the brain, which is why the fatigue persists. Lots of other factors can also contribute to the experience of fatigue. It really is a multi-dimensional puzzle. Depression and mood, we know, can be very closely associated with post-stroke fatigue. Sleep disturbances, nutrition factors. So we can easily imagine that if we're not getting good nutrition on board, we're not going to be able to contribute the same level of energy from our food sources, and that can lead to feelings of fatigue. Low physical stamina and endurance, which unfortunately is common after stroke, can also contribute to the feeling of fatigue. And we also know that how well somebody feels supported after their stroke and with their fatigue can be a big contributing factor to the experience. So people who report being well supported generally experience slightly lower levels of fatigue. So what treatments do we have right now? Well, unfortunately, they're quite limited. And they range from drug treatment, so pharmacological type interventions, to some light therapies, mindfulness training, cognitive behavioural therapy type training. But unfortunately, few of these have really been proven to be effective. In some part, that's because there haven't been very many trials done about post-stroke fatigue. And unfortunately, the trials that have been done with very small numbers of people receiving such treatments that we can't be sure they're actually effective. The other challenge that we have is that treatments often come bundled together. So it's a combination of perhaps some exercise alongside cognitive behavioural therapy, and that's tested in combination. So for example, if somebody receives a drug and mindfulness training together, if somebody's fatigue improves off the back of that treatment, we don't know whether it was the mindfulness training or the drug that actually affected the change. So what was actually the active ingredient that made the fatigue feel better? Fatigue education is an interesting one as well. I guess my big question is, what actually even is that? What does the education contain? And how useful and relevant is that for stroke survivors? And the current study that I'm leading, where I'm talking to stroke survivors about their fatigue, pretty much every single person has told me that they didn't actually receive advice and education from health professionals about fatigue specifically after their stroke. And if they did, it was only mentioned very briefly, and that there was no real education about how to manage the fatigue in daily life. So there's lots of uncertainty in terms of treatment approaches, and that's not okay, because we know that 50 to 80% of stroke survivors are living with some degree of post-stroke fatigue. There are a range of management strategies that health professionals suggest or tell us that they suggest to stroke survivors to help manage their fatigue. Education, as I mentioned, is a tricky one because we don't really clearly know the causes of fatigue. However, I suspect that information about strategies that could be helpful would be very useful for stroke survivors. So I'd encourage people to talk to their health professionals, and there also are online resources that are available, and I'd direct people towards the Stroke Foundation website for that. Scheduling can be helpful, and that involves really planning and organising your day or your week to provide enough balance between rest and activity. So you might notice that you have less fatigue first thing in the morning, and that might be the best time to schedule more complex tasks when you have that additional energy. You might try not to have too many appointments on the same day, or even within the same week period. Pacing means balancing rest and cognitive or thinking and physical activities in daily life. So this can mean breaking tasks into more energy saving chunks, or switching between types of tasks that demand different levels of energy. So for example, you might need to do a task that takes an hour of concentration, a lot of concentration, but you know that in order to do that, it's going to wipe you out for the 3 hours afterwards. Adopting a pacing approach to that hour of concentration could involve concentrating perhaps for a 20-minute burst, but then stepping away actively at that point and either having a rest or perhaps going for a walk or doing gentle activity so that you're giving your thinking concentration brain a break, and then going back to your concentrating activity after you've had that small rest period. For something like mowing the lawn, you might actually break that into smaller chunks, or have breaks with rests in between, or do it over sequential days across the week, if we can find a weather window to do that at the moment. Adapting tasks means finding different ways to do something, or using tools that might make it a little bit more easily. So we could think about switching something like the effort of doing up fiddly buttons for using things like zips or Velcro. Adapting other tasks might be something like switching books and reading, if that's a trigger for you, for audiobooks, which may be less effortful for your brain to manage. Adapting might also mean delegation. So who else is around that could help and do the task for you so you don't have to? And that doesn't necessarily have to be involving family and friends. It could be thinking about switching to online shopping and delivery as opposed to having to coordinate the effort of leaving the house to do that. Exercise is also an important recommendation, and that can sound counterintuitive. If you have fatigue, how on earth are you supposed to summon the energy to be more active? But we do know that exercise doesn't seem to make the symptoms of fatigue any worse, and that's important. And some people even feel that it helps clear and wash out the brain and the brain fog a little bit. We also know it's very important to help prevent further strokes. So I would highly recommend exercise, and it's good for boosting mood and helps support good sleep. So we still have far more questions than actual answers. And we realise that little's changed for stroke survivors in the last couple of decades, which really isn't good enough. So I'm working as part of the third Stroke Recovery and Rehabilitation Roundtable alongside Professor Coralie English, also here at the University of Newcastle, in this international collaboration that comes together every couple of years to really try and tackle the big questions in stroke recovery and rehabilitation. So in this fatigue-specific task force, we're working with 12 experts around the globe. You can see the countries highlighted there on the map, to bring together people with experience of fatigue after stroke, but also from some other conditions as well, to see what we can learn. And our goal is to really define a roadmap for fatigue research that clinicians and researchers from all over the world can get behind to try and drive our knowledge in the field forward, so we can really find the best treatments as a priority for stroke survivors. We know that for stroke survivors, fatigue research is a priority. People have told us that repeatedly. And as part of this task force, my role is to coordinate a consumer advisory group. So I'm working with 7 stroke survivors across 5 different countries to make sure that they have input and feedback into the ideas and the priorities that the fatigue task force are developing. So as I said, we really want to drive the field forward, and this is the first step in that. In the first instance, the fatigue task force has identified a number of key questions that we think are really important that we find answers to as quickly as possible. And I'll share those questions over the next few slides. However, we do have some overarching themes across this whole roadmap setting process, and they are: what are the priorities and perspectives of people with lived experience? Obviously very critical. How are people with aphasia included and considered in all key areas? Because we know people with aphasia are generally underrepresented, if not excluded, from participating in research. And we also want to overarchingly work out how we define, describe, and explain fatigue much more efficiently and effectively. So our first key question is, how do we really measure fatigue effectively? We do have some questionnaires that measure fatigue or aspects of post-stroke fatigue, but we know that they don't capture everything that's important, particularly that which is important to stroke survivors. And we also know that certainly current scales don't necessarily pick up people's experience fully. So for example, some questionnaires have cut points whereby a score over a certain point means that you have fatigue, and a score under that point is defined as not experiencing fatigue. But we know from stroke survivors' experience that that really isn't accurate. Measuring is important for research, and we need to assess the effectiveness of interventions as they're developed and tested. So has the fatigue improved greatly? Has it changed, but not enough to make a meaningful difference for stroke survivors? Or has it not changed at all? But people with fatigue also tell me it's important for them to be able to know that measurement is happening effectively. It lets people see their progress, which can be tricky to feel when you're living with fatigue for such a long period of time, and it may only be changing slowly. Measurement also helps stroke survivors really prioritise how they use their energy and their time when they're trying out different fatigue management strategies. So if it takes somebody 60% more effort to organise and schedule their day to manage their fatigue, is the benefit that they get from that for their experience of fatigue worth that additional 60% effort? Our second question is to try and really finally find out what the most likely causes of fatigue are. As I mentioned, we don't know the actual brain or body biology that drives fatigue, and that obviously makes it very difficult to come up with a treatment because we don't know what our target is. And one thing we do want to ask our stroke consumer participants with fatigue specifically is knowing whether there are different patterns or types of fatigue that we should be exploring so that we can target things more effectively. Or is it more important at this point that we just get to the bottom of the underlying mechanisms and biology and push for treatments from there? Our third question is to pick apart how we determine that somebody has fatigue and not tiredness or fatigue from a different condition. So as I mentioned earlier, lots of other conditions can mimic fatigue. So we need to make sure that they are identified and treated to let us really see what's specific to post-stroke fatigue. So for example, one symptom of depression is fatigue. And we know that around 1/3 of stroke survivors will experience depression at some point after their stroke. So if we treat the depression, does the fatigue go away or does it persist? And then what do we treat that with? And what are the best ways to screen for the different factors for post-stroke fatigue? So once fatigue comes on a little bit later, people are obviously back home in the community. So who is the best person to be doing the screening with stroke survivors? Is that their GP? Is it the allied health professionals such as physios and occupational therapists who people might be working with in the community? Is there a checklist that could be used to screen for these different things to funnel down to whether post-stroke fatigue is the primary problem? And there is no checklist at the moment, spoiler alert, but we think it's something that could be very helpful if we could develop one. How do we develop effective interventions and management strategies? Well, that really is the final million-dollar question. To cure or to treat the fatigue, we need to understand the biology, and that really is the biggest missing jigsaw piece at the moment. While we're waiting to find that missing link, we need to develop and test much more effective and comprehensive management programs. And the team that I'm working in at the moment here at Newcastle and a team in the United Kingdom led by Professor Avril Drummond at the University of Nottingham are working collaboratively together to try and look at effective management. So we've talked to clinicians, sorry, this is the research team here, locally, and Avril at the left-hand end there in Nottingham. And the two big phases of our work that we've completed at the moment was firstly talking to clinicians about what they prescribe to help people manage fatigue. And at the moment, we're just finishing off a study where we've talked directly with stroke survivors and their caregivers to learn from their experience about what helps and what doesn't help them. Our next step moving forwards will be to try and co-design a management program to test whether such a combination of management strategies can be effective. And by co-design, that means we're going to work collaboratively with stroke survivors, caregivers, clinicians, and expert researchers to really come up with the best bundle possible that we can then test and see if it's helpful. So I wanted to share some of the top tips from stroke survivors that they've kindly shared in the qualitative study that we're just finishing off at the moment, because their tips are absolute gold. So the first top tip that people shared is to really listen carefully to your body. And that involves balance between activity and rest, and working out really what is your best rest, because for everybody it's different and personalized. So one person's best rest might be having a nap for a short period of time and getting up and moving around again. Another person's best rest might be meditating, or it might be removing all stimuli altogether and lying down in a dark room very quietly for a period of time. So finding the best rest for you. The next top tip is to really explore your own fatigue and learn what your personal cues are. So that might be triggers, such as physical triggers, reading, doing maths type activities, or problem solving. Some people also talk about high stimulation environments, such as big noisy dinners with groups of people, or shopping centres as being a trigger. And really mapping those experiences and noticing how you feel. Feedback from other people can be helpful as well. So speak with your loved ones, friends, family, because they might notice aspects of your fatigue creeping into your life that you haven't noticed. So I certainly know that stroke survivors have told me it's taken their spouse or their caregiver to actually notice that they're slurring their words more, which is one of their key signs of fatigue, because their muscles have got really tired as a part of the fatigue, and that's affecting their speech. The next top tip from pretty much all of the stroke survivors I spoke to is exercise, do some. And as a physiotherapist, I absolutely advocate that top tip too. As I mentioned, people tell us really consistently that it doesn't seem to make the fatigue worse. So I'd strongly encourage doing anything that you enjoy doing to get yourself slightly breathless or slightly huffy puffy, because then we're actually doing our heart and our brain health some real benefit. Another top tip is to really use support networks. And that can be both formal support or informal support networks. So talking about your experience of your post-stroke fatigue. We know that mood can contribute to fatigue, as I've already mentioned, particularly depression and anxiety. So using your health professional contacts, such as general practitioners or psychologists or other allied health professionals, to share that information with them to helpfully set a treatment or intervention around your mood. We also know that informal supports are also very, very helpful. And that feeds into our next top tip, which is really finding your tribe. So we know that peer support's really powerful for stroke survivors, and I'm sure everybody here listening today is very aware of that, as you're all highly connected together with your stroke peers through the Stroke Recovery Association. Also find your cheerleader squad, and that could be your health professionals, it could be researchers, it could be other people that are really going to support and champion and advocate for you in helping manage your fatigue. Acknowledging the new you and the new you who is living with fatigue is another top tip. And obviously that takes a bit of time to get your head around and work towards. But acceptance of the fatigue as being something that's hanging around and lingering, stroke survivors tell me, is actually really powerful in setting the agenda to come to terms with the fatigue and the challenge of living with it, and thereby actually start gaining control over that. Prioritising's another top tip, and really focusing on what matters to you. Without judgment from yourself or from others about what you choose as your priority. So everybody's going to have different things that they'd like to prioritize at different times. And often that's not necessarily the cleaning or the tidying. It could be prioritizing activities that bring you joy and bring you real meaning. And it's really important to schedule in those activities that bring you enjoyment throughout the day, as well as all the other boring life activities as well. And the final top tip from stroke survivors is to be kind to yourself living with fatigue. And overwhelmingly, from the 17 people that we interviewed with post-stroke fatigue, most people mentioned this as a top tip. It's learning how to roll with the fatigue and be kind to yourself. It's not a weakness, it's a brain injury, and therefore, you have to work hard to ditch your inner perfectionist. I really liked that description, to allow yourself to be kind when living with fatigue. Do please feel free to get in touch off the back of this presentation this morning. The organisers will have my contact details as well. I'd really like to thank everybody for attending such a great organised day today, and thank you very much for the invitation.
That was tremendous, was it not? I do have to point out the obvious though, isn't it? Physiotherapists, they're always into movement. You know, it's the key for us all really in keeping healthy. It's really essential, and physios are really at the forefront of all that. So now we have some time, I guess, just to share your experiences of your fatigue. If you're a stroke survivor and you want to tell us how it's impacted your life and some of the strategies you've used, please feel free. And if you're a health professional and you have particular strategies that you'd like to sort of raise, feel free to put those forward as well. So I'm going to open up for questions, both from the floor and also online. And remember, if you're online, just to type your questions into the box, and that will then come up. Oh, and it's going to come up here for me, isn't it, Rachel? I just love these technology things, they're great. So does anybody want to share their experience of fatigue going forward after their stroke?
Yeah. Possibly. Oh, someone's just giving me the microphone.
So Gary, you're going to share yours, love?
Look, sometimes I feel like I'm a con job because I am a stroke survivor, but I had the things I found that, how do I say it? It's 11 and a half years ago since I had my stroke, by the way, but I went back to swim, bike,
Can you just
running.
hold the mic a little close to your mouth? Thanks.
Sorry, what I'm saying is I went back to swim, bike, running, doing triathlons, and I did return to work. But I still suffer fatigue, and it's not physically I look fine. Physically, mentally I'm usually okay, but sometimes there's something that will let us down. I found some of the things she said very interesting because out of it, I find the physical exercise helps me immensely, but the thinking patterns are something that I sometimes have problems with, where I get brain fog and my brain lets me down. Not often, but it does happen. And one of it is like being back at work, well, I've worked for the same company for 9 years. I'm actually just on the verge of retiring, so I'm using up my long service leave at the moment. But one thing I found, that you were given a new task, it was the brain would, how to say it, would affect you adversely. I've been very lucky to have very good bosses over the last few years, but the other thing was the emotional side of it. I think I'm lucky. Sometimes I feel like, I feel like I'm how do I say it? I feel like I'm one of the lucky survivors, but I still suffer fatigue from time to time, and it's not towards the physical side. If I go out and exercise, that's my dream. That I'm good doing that. But there are other things sometimes when people put emotionally, something that your brain can't think it through fast enough, so it's still there. And I just make that comment that although some stroke survivors seem like they're absolutely perfect, sometimes you're not. And for the average layman to see that, they just don't.
So I guess just to summarise a few of those things, Gary, you're saying that for you it's not been a real physical issue, but it has been sometimes when you're overloaded either emotionally or cognitively or overstimulated is when the fatigue comes for you. And it's interesting, isn't it? And I hadn't ever thought about those high stimulation areas, but I guess one of the things about fatigue that we hear a lot as health professionals is that when people go back to work, it's that how they go back to work is really important. And if they can go back in stages, it's certainly a lot more relevant for them than going back all at once. So a full 7-hour day all at once doesn't necessarily work for somebody. However, going back 4 hours a day and then building that up over time. But isn't it interesting? One of the other issues we have with stroke survivors too is that they tend to overestimate their ability in terms of going back to work. We all want to be well and we all want to be cured. And I guess it's that word cured that comes to mind occasionally for stroke survivors. And so we want to go back to work. We want to resume our identity as we all get from our work. And when we go back to work too quickly, it can often work against us in the long term. Okay. Anybody else like to share their experiences of how they've handled their fatigue?
So we've got a question from online from Catherine. I had a stroke 5 years ago and have extreme fatigue since. I found fatigue has limited my ability to undertake multiple daily tasks. For example, if I want to go to lunch with family, I can't.
Can you just slow down a little bit, love, please?
Sorry. If I want to go to lunch with my family, I can't also wash my hair. And I was wondering how fatigue has impacted other people's lives.
Okay, so what she's saying is that it's a physical thing for her, very much so that she has to pace the sort of physical things that she does in order to include them all in one day. Is there any health professional here who'd like to address any of those issues rather than me talking from up here all the time? Because I guess it is one of those things that Dawn addressed, and she was talking about that pacing issues, so that you work out what you've got to do in what day and then organise your time with rest periods. And I think the other thing that she talked about too was not having as many appointments on one day. However, washing our hair is often something that's essential for us, isn't it, before we go out? So one would need to do that really early and then have a rest period and then possibly look to go out as well. Anybody? Yep, somebody here like to address it? Thank you. Would you mind just identifying yourself, please?
Hi, my name is Stephen. I'm a physiotherapist currently working at RPA Hospital on the stroke board, and I sort of treat patients in the inpatient and outpatient setting as well. So I'd just like to echo what Dawn has said in her presentation. With fatigue, I think it's definitely important to sort of identify the best time of the day that you feel like you have the most energy, and sort of schedule your day around that sort of moment, because we know that that's sort of the best time where you can sort of give that event that you have on your full attention. And definitely, as she said, be nice to yourself. Don't be too down, that you can't sort of do all those things that you used to do, and sort of giving yourself permission to sort of take a step back and be able to still enjoy what you're doing. Otherwise, it sort of can pile up in terms of the way you feel, that you can't do this event and then you can't do that event well. And as a physiotherapist myself, I would also echo that continue to do exercise on a sort of semi-daily basis can continue to help with your feeling of fatigue. So that's my recommendations from my experience.
Thanks, love. That's great. Okay, excellent. Anybody else like to share their experience of fatigue?
Yeah.
Ava?
I think one of the things that I'd like to share is that not knowing that why I am the way I am since my stroke. I've changed as a person. I've learned, I just, from the past, if I had something, I'd have an operation and I'd be better. With stroke, I gave it 3 months and I wasn't any better. And then, of course, getting involved with stroke recovery, you learn from what you get presented with that stroke is a journey. It's something that's going to continue. In turn, I would have times at night where I would wake up and I would really think about the things of the days gone past, and I'd work out how I could fix that when the day comes. And of course, in the morning, the day would come, and I'd try to think, now, what was it I was going to do? And I realized I do nothing. And then as the day progresses, I get frustrated because I'm not doing anything. I'm going to, and I have no motivation, I have no energy, and today I'm now hearing why. I was actually whipping myself because I'm not achieving anything. I want to plan, I used to do things, and I don't. Today I've got answers why. And I think being involved with stroke recovery, and it'll be 8 years for me this year, and I think I'm very thankful in hearing and learning and knowing that it's a stroke journey. It's not something that we can change. It's going to be part of my journey for the rest of my life. And I'm looking forward to putting into practice the things that we're learning today. And so I think part of this is being aware that it's part of the stroke and not something that we can just put aside and continue with life.
Excellent, thank you. I guess one of the things that Brenda Booth, who did the acknowledgement of disability, talks about is her fatigue. And I have to say, I think before Brenda started to really raise the issue of fatigue, that it wasn't really on the agenda for health professionals, really. It was just something that could be quite easily dismissed when you went back to your doctor. However, it's really wonderful, isn't it, not to see that physiotherapists now have it as part of their practice and they can acknowledge it with people, and also that we have great researchers working on that process now. Because I think the voice of stroke survivors has got louder in regards to issues that they want researched. And, 60% of people after stroke, 60 to 80% of people after stroke is an enormous number to be dealing with the debilitating issue of fatigue. And I think one of the quotes I get from Brenda, I get a lot of quotes from Brenda, but the one that always sticks with me is that one day's a diamond and one day's a stone. And on the stone days, I just sit and I let the world go over me like a river, and I wait till the next day when I'm hoping it'll be a diamond, and then I'll be bright and up and about again. And it's a lovely idea, isn't it? And it really does, I guess, depict that whole process of fatigue. Some days we just want to be heavy and stop, and the other days when it's not a part of our life and it doesn't overtake us, we're able to be bright and shiny and a little bit out there. So that's just something from Brenda. Do we have any other people who'd like to share a comment or an idea? Louise? So Louise Sellers is the manager of the ACI Rehabilitation Network.
Thanks, Michelle. And thank you so much for the pleasure of being here today. So
Could you just hold it a little closer, love?
Sorry, Michelle. So I think it's really interesting what Dawn was saying about working with researchers around the world and also looking at fatigue from other conditions. So one of the things that has come out recently in some other work that I'm doing around fatigue is that concept of pacing, but also really important to work below capacity. So instead of saying, well, yesterday or last week, I managed to mow the entire lawn, or 3/4 of the lawn. Today I'm going to do the entire lawn. It's actually about really slowly edging your way further into things. And I think the analogy you gave about returning to work was really important, Michelle. Not constantly to use, I think it was it Ava who used the analogy of whipping yourself, not saying I'm going to go harder this week than I went last week. It's actually really slowly and gradually working your way up on things instead of thinking you always have to go more and more and more and more, because what we know from other conditions is that's actually really counterintuitive. Just wanted to say that. Thanks, Michelle.
Yep, thanks, love. And I guess it's the exercise analogy is also an important one as well. So, you know, for those of us who lead a sedentary life and we think, oh yes, it's time, summer's coming, we have to lose some weight, let's start walking. Well, we don't go out on our first day and do an hour's exercise. Well, we do it in 20-minute spots, and then we gradually build that up because our body needs time to reorganise and get used to that movement again. And it's the same with our brain. And it's really important to remember that it is a brain injury. And I was fascinated by the things that Dawn said about our brain swimming in some form of fluid that makes it really difficult for us to understand why fatigue is there. And I'd really like to see some research into that really, I guess, what would you call it, pharmacological aspect of fatigue, not only just the experience, but the pharmacological, what causes it and what can be done, because we're always looking for that pill, aren't we, that makes life a lot easier and easy for us to adapt to. Do we have any more experiences or questions that anybody would like to ask? Okay, Rachel's giving me the roundup. Okay, so thank you very much, and that was excellent, and our sincere thanks to Dawn, who went to so much trouble to put that together for us, because she really was under the pump when we asked her to do that.